Swine flu is also called influenza A H1N1. It is a respiratory disease. It's from pigs and it's caused by the type A influenza virus that is normally in pigs. People normally do not get swine flu, but there have been human infections. They do happen. Swine flu viruses, they've been reported to spread from person to person, but normally they do not spread more than like 3 people. In late March and early April of 2009, there were reportings of swine flu infections in Southern California and in Texas. Also, other U.S. states have reported swine flu cases, infections in humans, and there have been cases reported internationally. An updated case count has confirmed that swine flu infections in the United States is kept at the website http://www.cdc.gov/H1N1. That's where you can find all the local and state health agencies. They're working together and trying to find a solution to this situation. CDC has decided that the swine flu influenza virus is contagious and it is spreading from human to human. However, it is not known how easily the virus can spread between people. The symptoms for swine flu are like the symptoms to a regular flu. You can have a fever, you might experience a cough, sore throat, you might have body aches, you could have a headache, you could deal with chills, and you could also feel fatigue. Some people have also said that with swine flu they've had diarrhea and vomiting problems. In the past, there have been severe illnesses such as, pneumonia and respiratory failure and deaths reported in people who have been infected by swine flu. If you have a underlying chronic medical condition, swine flu can just make it worse. It is unknown how the influenza A H1N1 virus is thought to be spread, but it's kind of thought to be spread from the same, like a normal flu. The flu virus is spread from person to person, normally through coughing or sneezing. Sometimes people can be infected by touching something that has been touched by a person who is infected with the flu, and then they touch it, and then they touch their mouth or they touch their nose, and then they can get the flu that way. Swine flu viruses are not spread through food. If you eat pork or any pork products, you cannot get the swine flu. You want to make sure that any pork that you eat is properly handled and cooked and they are safe to eat. People who are infected with swine flu, they can start infecting people up to a day before their symptoms even develop, and then they can go on for 7 more days after they become sick. So that means that you're able to spread the flu before you even know that you have the symptoms or before you even know you have the sickness, and you can continue to spread it while you are sick. The first and most important way to help prevent from getting the swine flu is to wash your hands. You want to make sure that you're just a healthy person, get plenty of sleep, be physically active, manage your stress. You want to make sure that you're drinking plenty of fluids, eat good healthy food. Don't touch fire or surfaces that are already contaminated with the flu virus. Also avoid anybody who is sick. Germs are easily spread by one person touching a surface, and then they contaminate that surface with the germ, and then someone else touches it and then touches their eyes or their nose and mouth. When a person coughs or sneezes, there are tiny little droplets that come out of their mouth, the infected person, and then they move through the air. And the germs can be spread when a person touches those droplets from another person who is already sick from like a surface, like a desk, and then they touch their own eyes or the mouth or their nose before they have the chance to wash their hands. Some viruses and some bacterias can continue to live for 2 hours on the surface of anything, such as like cafeteria table, doorknobs, any desk. That's why it's important to frequently wash your hands, because it'll help reduce your chances of getting flu from touching these contaminated surfaces. Currently, there is no vaccine available to protect against the swine flu, but there are things that you can do every day to help prevent spreading the germs. You can take these everyday steps to protect your health. First, when you cough or you want to cover your nose and mouth with a tissue when you cough and you sneeze. Once you're done, you want to make sure you throw that tissue away in the garbage. Wash your hands frequently with soap and water, especially once you're finished coughing and sneezing. You can use alcohol-based hand cleaners. These work very well. You want to make sure that you avoid touching your eyes, your nose, and your mouth. That's how germs are spread easily. If a person you know is sick, avoid contact with them. If you do get sick with swine flu or any kind of flu, it is recommended that you just stay home from work or from school and limit your chances of infecting other people. If you are sick, you just want to limit your contact with any other people as much as you possibly can. You don't want to go to school, you don't want to go to work. You want to make sure that when you cough, you cover your mouth and your nose with a tissue. It can prevent the people from around you getting sick. So you want to make sure you throw that tissue away in the garbage. If you do not have a tissue, cover your cough or your sneeze and then wash your hands immediately. Do this every time after you cough and sneeze. You should wash your hands. If you frequently wash your hands, it's the most protective way for you not to get germs. You want to wash with soap and water. You can also use an alcohol-based hand cleanser. When you wash your hands with soap and water, you want to use warm water, and you should wash them for about 15 to 20 seconds. If you don't have soap and water, then you can use the alcohol, disposable gel sanitizers, or the wipes. Those are most commonly found in, any kind of big store or any small little drugstore. If you're using the gel, you want to rub the gel until it's dry. You don't need to use water. The alcohol that's inside of the gel will kill the germs itself. It is recommended that you use medicine that is prescribed to you. There's oseltamivir and zenamivir. There are two different medications to help treatment and prevention of the swine flu infection. There's also antiviral drugs that are prescription medicines. You can take pills, liquid, or an inhaler. They help fight against the flu from reproducing inside your body. If you get sick, the antiviral drugs can make your sickness feel reduced, and they can make you feel better faster. But also, they might help you prevent serious flu complications. For treatment, the antiviral drugs work best if started soon after you get sick, normally within 2 days of you having symptoms. If you live in areas where swine flu has been identified and you become ill with like flu symptoms, that includes a fever, body aches, you have a runny nose, sore throat, you feel nauseous, you have vomiting or diarrhea, you might want to contact your doctor if you're worried that you have these symptoms. Your doctor will determine whether influenza testing is required and what treatment is best for you. You should stay home if you are sick and avoid contact with other people as much as you possibly can. If you are sick and you have any of the following warning signs, you want to go to the emergency medical care. For children, emergency warning signs, you need to go and get urgent medical attention include fast breathing, they have trouble breathing, they have a bluish skin, they're not drinking enough fluids, they're not waking up or interacting with everybody, they're just kind of there. Or if they're being so irritable that they don't want to be held or touched. If they have flu-like symptoms, improve, but then after a little bit they return with a fever and worse of a cough. Or if they get a fever with a rash. Adult warning signs when they need to go and get urgent medical attention are if they have difficulty breathing or shortness of any breath. They have a pain or pressure on their chest or their abdomen. Suddenly they feel dizzy, they're confused, or if they just have a persistent vomiting, you want to go see a doctor immediately. The severity of swine flu in humans can range from mild to severe. Between 2005 until 2009, there were 12 cases of swine flu in the U.S. With no deaths happening. However, swine flu infections can be very serious. In September 1988, a woman of 30, she was 32 years old, she was pregnant. She was hospitalized for pneumonia after being infected with the swine flu, and then 8 days later, she died. In Fort Dix, New Jersey, the swine flu outbreak in 1976, it caused more than 200 cases with serious illness in several people and only one death.